Leadership Award Ayurveda by Ayushman Bharat Nyas in association with IMA. Dr. Sharika is also a faculty in the Art of Living since 2009, and she has been a faculty of Ayurveda for Sri Sri Yoga teachers training since 2017. We are really very grateful to Dr. Sharika, for taking time out for us and conducting this session and answering some of our questions in regards to Ayurveda. So once again, a very warm welcome to Dr. Sharika on all our behalf. I will now request Priyanka Didi to take the floor.
Great. Dr. Sharika ji, warm welcome. And one thing I want to tell everyone, among all what has been said about her, I can tell you, I have had the privilege, the honor, and the good fortune to have been being treated by her for the across last 1.5 years. And I can tell you, Ayurveda has been remarkable. That's my personal uh, the benefit that I have got. So, very fortunate and very glad. Thank you, Dr. Sharika ji, for taking out your time. Uh,
Thank you.
so,
Mm.
Sharika ji, welcome. So, please, please continue.
Thank you, Priyanka ji. I think there were few participants unmuted, so maybe those noises were there in between.
Yeah. So, Dr. Sharika, the format we'll keep it is I have got we had asked questions from everyone, invited questions. So, I have compiled them and then I'll ask some of those questions. And then in the end, if we do have a little time left, if with your permission, if 2, 3 questions live can be taken.
Sure, definitely.
So, the first question that has come from many, many people is that there is something called illness and there is something called wellness.
Hmm.
And what is the difference and how can Ayurveda go from journey from illness to wellness?
So, I mean, illness and wellness, it's a stark difference. Everybody knows it. Where do you want to be? So that is, I mean, I don't have to tell the difference. See, what wellness or well-being, that balance will bring you is happiness, which will be you wake up with a smile. You're looking forward for the day. You feel light mentally, physically. All that feeling of lightness is what is the indication of swasthya or wellness, well-being. So Ayurveda also mentions about that. How you feel when you wake up is the biggest indication to assess how you are or how well you are, how balanced you are. So you can look into that as well. Sometimes you wake up with anxious. You're anxious for the whole day. What is going to happen? Or you've been planning for the all night, and then in the morning there is something big decisions to be made, and you're anxious about that, whether everybody will agree to it or not. Or there is some decision you're confused about. Or you have like very dull. Okay, there is always already so much of mental and physical stress, and then you're feeling dull and depressed. All this is indications of illness also. So many a times we think it is normal to feel like that. We don't know what is feeling normal. Many a times we are used to feeling certain way, right? So this is something Ayurveda teaches us to look into. Basically, when we teach dinacharya, ritucharya, and all that, it is to maintain your health. So one who is already balanced, if you want to maintain your health, then our masters, our acharyas mentioned that you follow this routine, what suits you the best, in according to the day and night, according to the seasonal variations and all that. So that will help you maintain health. Before we understand the illness and wellness, one more important thing is it is also to understand what is the purpose. So many of you have already asked. First question is itself is about illness and wellness, but what is the purpose? Why do you want to be well? Why do you want to be healthy? Huh? We just want to be healthy. We don't know what is that, what happens after that. So if you have thought about it, maybe some of you can share. Why do you want to be healthy? One or two people can share.
से रिपीट इन हिंदी तो क्वेश्चन ये है कि आप ये स्वस्थ क्यों रहना चाहते हैं, राइट? आप चैट पे भी लिख सकते हैं, यू राइट ऑन चैट, और आई डू वांट टू बी हेल्दी।
So the future should be good for a future.
For your future, okay. To do various
We don't know.
activities,
We
okay.
don't know about quantity of life, but we want quality of life.
Okay, that's very good. You most of you want to carry out your work with efficiency and ease, okay. Then anything else you want to add other than these? Yeah. Nothing else you can think of? Healthy body, healthy mind, okay. But why? Why do you want healthy body and healthy mind?
To enjoy your life.
Enjoy your life. Yeah. Happiness, to remain happy, happiness with life, okay. Okay, and I'm sure most of you are meditators. All of you are practicing yoga, sadhana. Huh? So in Ayurveda, it is told the purpose of understanding this knowledge is to attain that happiness. So there are a lot of duties and responsibilities that you have to fulfill with your body, mind, right? You have responsibilities at work, your family, you have to earn, you have to, enjoy life also. You're already, certain food you enjoy eating, all that put together. Without a healthy body and mind, do you think you will be able to achieve all this? So ultimately, I mean, even though worldly so many things are there, ultimately you want to, we are all spiritual in the spiritual path, and we are all seeking that, that progress in life. For that also, illness or imbalance or any kind of diseases can become a hurdle for you in the path. So this is to help you maintain that. Maybe there will be many situations where there are imbalances that can come and go, but then how do you handle it? How do you keep the balance? And so for that, this knowledge is essential. So along with the yoga, if you're practicing Ayurveda, along with it goes like sisters. That's what Gurudev says. Both yoga and Ayurveda, like, it goes together. It's the same, similar principles, and it is easy to practice together as well. So that is the relevance of wellness. So there are many moments where you can be on the other side, but with awareness, you will be able to come to balance also. Okay. Yeah.
So thank you, Dr. Sharika. So, uh, a lot of people have this perception that Ayurveda is something really complicated when everything else has not worked. जब सब कुछ try कर लिया, nothing has worked, then people say, अच्छा चलो, now let us try Ayurveda. So is it like that? So can you please throw some light as to, practically speaking, how can one incorporate, and is it that difficult, or how can in an easy way people make it a part of their life?
See, Ayurveda, many of you might have heard about, or you have this notion that Ayurveda takes time, and then many of you have this notion that okay, if nothing works, maybe I'll go for Ayurveda. We'll try this also. But the issue is if it is in the beginning stages, it's easier for us to treat. Not that even it is chronic conditions, one of the best choices would be definitely Ayurveda. It's not that it will not give results. So even in the chronic conditions, you will start feeling the relief within few days itself. You know? So you cannot expect. For example, I say uh, you have. I always share this example. You have some point to reach, you know, and then you set out from the house, and then you can take so many routes, longer routes, shorter routes. There are so many routes that you can take, and sometimes you go off the route. That is where there is an imbalance happens. You can go directly to that point, but then you go off route, you'll get lost, and then they'll take so much of time to come back to the track. So if there is a chronic imbalance, if it has happened over a period of time, to coming back to the track also may take some time. The body has to understand how to respond, because it's used to be, it's stretched so much. There's one of our senior art of living teacher, Dr. Vinoda Kuchipille. She's our famous scientist also in various big institutes. She's been there. So she was once telling me, it's like an elastic. Body is like an elastic. It will bounce back. But then if you see, after a certain time, the elastic also, once it stretches, it cannot bounce back. That elasticity it loses. So similarly, in chronic conditions, it may sometimes take time, but then in acute conditions also, it will give you enough immediate relief as fast as few seconds. So one example I can share is during COVID. Damini was mentioning about the COVID situation. So many a times there were patients who were calling for, their oxygenation dropped. So with one medicine, just one pinch of medicine in their mouth, it used to come up. Even though it is below 80, it used to go up to 90, 95 within seconds. So is it slow or fast? Isn't it? So like this, there are many formulations and treatment protocols and all that can help. But it also depends on the condition, how you have ignored the condition for too long, and so many like that. For example, certain people, um, first of all, they don't agree to follow a diet. They cannot change their routine. They don't like Ayurveda medicines, and they cannot exercise. How will we correct it? Isn't it? So you cannot just depend on popping some pills. We will have to bring everything together: meditation practices, your pranayamas, exercise, diet, everything has to go together, and then it will give result. If it is more chronic, it may take time. Acute conditions can give immediate results also. So it is not about acting slow or fast. It is about reversing that condition and bringing that balance back. Even though you have some chronic imbalances, still you feel good, no? No, some days you feel good, right? So that is an indication that okay, there is healing happening. It's not that you are always in pain, isn't it? So that body is giving you the glimpse of okay, this is also this at least few hours in a day I'm feeling well. I'm talking about those who have chronic imbalances. Yeah. Okay. So I think that answers your
Yes,
question. Yeah.
yes, doctor, it's very interesting because it is true because today is the day of instant everything. And but undoubtedly, like I can say, there are some things in Ayurveda which I've tried myself, that they work really instantly. Like some of the medicines, even I have been prescribed, they have an instant effect. So no doubt. You know, the my next question, which people have said is, people today, if I can put in different buckets, there are around five main buckets I've been able to capture the problems people have given. Chronic problems. Number one, people say knee pain. Knee
Mm,
pain is a very, very widespread syndrome. Number two, people say people suffering more and more from problems of gas, bloating, all, not being able to digest very well. They
mm,
don't eat they don't eat too much odd food, but still they suffer from gas, bloating, etc.
mm,
Then number three, that what has come up from people is sleeping. Sleeping is a major issue people are facing. They are not able to sleep. Now, number four is to be able to sustain energy levels.
mm,
Energy levels are going down. People say today people in their 40s also energy levels are becoming very low as what it should be. And the last thing is people are suffering more and more is from people which is heart problems, diabetes, these kind of so-called very, which we consider very, which were never heard of for people in the younger age. But so, can you please throw some light? Of course, for treatments, people can reach out and take, but how they can ensure they can minimize or prevent, or what can be done?
mm. Priyanka ji, though you have categorized it into five buckets, I would put it all in one bucket. Most of the conditions that we discussed now, it's it's our lifestyle, your routine. That is the main reason for all these conditions, especially like knee joint degeneration in the bones and the joints, or I think somebody is unmuted. Yes.
Yeah.
Okay. So then gas, bloating, restlessness, sleep issues. If you actually see, all this is these are induced because of our current lifestyle, because we are keeping your mind and body so busy. We don't take out time enough to ground your system, your nervous system, meditate, you just reflect yourself. Many times we forget to do that. Even and since COVID happened, everything went online. So now online and offline activities, there is no gap. We are always busy. Even if you're resting, you're planning for something, there is always some activity going on, mental activity and physical activity. So these lifestyle that is we are trying to manage, these always bring up two imbalances, that is vata and pitta. So vata is responsible for regulating all the activities, movements in the body, easy movement, musculoskeletal joints. All this is also regulated by vata. The nervous system, the activity in the nervous system, that transportation, information, all that is also vata. Um, so all this, when it is getting affected, it will reflect either as elimination issues, or it will make you restless, gas or bloating, or even the sleep, your restlessness in the sleep. You're not feeling like, when you go to bed, you're not getting sleep. It will take some time, or you wake up many times during the night, very very light, disturbed sleep. This is all because of vata. Yeah, that grounding is not happening. You are not able to wind up from, disconnect from all that activity and then slow down, right? And then pitta, when there is imbalance of pitta is the main control, main activity of pitta is to support the digestive system, hormones and all that. So whenever there is a pitta imbalance, then it can lead to any acidic tendency in digestion, irritability. Your body heats up unnecessarily, too much. Yeah? So you feel burning eyes, you cannot tolerate heat. All this come up when there is a pitta imbalance. You're easy to snap. The minute somebody comes into a discussion, you are like ready to pounce on them. Yeah? So this kind of behavior, all that comes up because of pitta, because we are already under a pressure to get things done, isn't it? So much of targets and so much of planning that has gone into, you have to achieve all that. So all this pressure and stress put together, definitely it will lead to vata and pitta imbalances. Current lifestyle talking about, and then eventually on a chronic this thing, it goes on like that. It will lead to some degenerative changes in the bones or joints. It can make your nervous system, you feel stressed, and then your sleep is affected. You want to meditate, but body is restless, mind is restless. You want to sleep, your sleep is disturbed. You want to eat well, there is gas and bloating, elimination is not proper. So these are very common symptoms when these two are out of balance. Mm. So what to do about it? One is, of course, uh, you watch what you eat. Don't keep snacking too many times in between. Whenever you feel like, or whenever you see something, you keep eating that. This is something which we need to avoid. And anything which is highly processed, I'm sure you all know that. Anything which is highly processed and heavy to digest, keep it away. Mm. And too much of salty food, all these salty snacks and all that, it is better to avoid that as well. Mm. So these are common things I'm talking about. And then do something to correct the elimination. How to correct the elimination? You can take maybe haritaki or triphala, which is very mild. Small doses you can try. If you're already taking something related to that, that's fine. If your doctor is already giving you something, then continue that. So correcting that itself will make a huge difference. So most of the root cause of all these conditions which we saw is again coming back to your gut, how you digest, how you process food, right? So what to eat now? Hmm? What will you eat? You have to cut down everything. Is it like that is one fear, no? To go to the Ayurveda doctor, they'll say no to this, no to this, no this. So what
Yes.
at end of the consultation, you are worried what to eat. Now, my wife will scold me what I will make. So this is very tricky. But then, if you actually see our traditional meals and all that, it actually is very balancing. So you go back to your uh, traditional recipes which your grandmothers made. That is also very, very balancing. All those modifications that happened, that is where the problem happened. And then, so to keep the system in balance, three things are important. One is meal times, one is sleep, and one is exercise. So if these three are uh, good, your digestive fire is good, your metabolism is good. And when your metabolism is good, your energy levels will be good, your immunity will be good, your stamina will be good, everything will start falling in place. So, whatever suits you, maybe. So, today somebody was there in my clinic. So, they thought the certain kind of a food helped them a lot, but it was actually giving them imbalance. So they think, so it is our common thinking that, okay, this is good. Somebody told this is good. I should also try it. But it doesn't work like that. It doesn't work for everyone. If something worked for someone, it may not work for you. You know? Okay, so something happened on
Oh,
this, Priyanka ji.
yes, we can cancel this. Yeah, yes.
Okay. Right. So coming back to the buckets that is told, to manage Vata and Pitta, one thing is follow good routine. You maintain a timing for meal time, sleep. Don't make it very erratic. One day you slept at 9 o'clock, one day you slept at 10 o'clock. So all that erratic nature of routine will affect your system. Yeah. And then again, meal times also. Decide your meal times. Some of you need 3 meals or 4 meals. Some of you need only 2 meals. But then don't keep it every time. So one day you ate at 10 a.m., then tomorrow you are taking at 12. Then one day you skipped altogether. So this pattern of erratic meal times also will give these lead to these imbalances. Are you getting it? So that is another thing. Similarly with sleep as well. So all this, if you can tune or correct your routine and meal times, 50% is corrected. And then if it is so there are some chronic wear and tear, there are medicines and supplements to heal that. Yeah. So
So, Doctor, one thing I just want to ask here or add here that most of us are meditators here. Somehow, meditators have this notion that हम कम सोएंगे 4 घंटा 6 घंटा we just sleep for 4 hours 6 hours because we are meditating. It is good enough. But and now demands for people, for example, there is office work, then like you said, online, offline, then sadhana, sessions. So in all this, somehow, sleep has become more and more less important for people. So
mm,
can you please share like, what is actually the impact, even if one is meditating, minimum मतलब कितना एक बैलेंस तो रखना पड़ेगा, right, for good health.
yes. So it depends on how your activity is. If it's too much of physical activity or too much of mental activity, both conditions you need good amount of sleep, like 7 hours or something like that. Because this is activity means you are inducing more vata imbalance, too much of activity. So to ground that nervous system, all that, sleep is essential. That rest is essential. But then it is not about the quantity of sleep alone. The timing also is important. You cannot just every day you are sleeping late, but I am compensating 7 hours, may not work always. Because if you are sleeping during the day, you spill it over, right? Suppose you're usually waking up at 6 o'clock, but then since you are sleeping late and then you are waking up at 8 o'clock, so whatever, that change itself can induce some toxins in the body. For example, those who have that habit to sleep late and wake up late, their tendency for congestion, mucus, all that will increase. And then those who already have congestion and mucus, and if you're sleeping like that, it will not heal at all. So the minute you start waking up earlier, you can see the respiratory system clearing up better. And that is the time also to do pranayamas, and that will aid this cleansing better. So morning hours, that is very important. So sleep is dependent on your activity, whether you're doing mental activity or physical activity. Based on that, you can plan the sleep. So 6 hours, 7 hours is good enough for an adult. Maybe children may need more. There are certain conditions where extreme exhaustive work, then they may need up to 8 hours also. So meditation is not just to, it's not to compensate sleep. Naturally, your energy levels will be better and prana will be high. Qualities of sleep is also better. Deep sleep is better. So you may need maybe shorter amount, 6 hours, 7 hours also will work for you. But that doesn't mean that you are sleeping like 4 hours, 5 hours, right? And then you meditate. But in the meditation also you are drowsy. You don't know if you are sleeping or meditating. This happens many times.
Yeah, doctor, and the thing is that we have all heard health is wealth. ये तो हम सबने सुना है. And even on the people on the spiritual path, when we talk about Ashtalakshmi, the first thing that comes is swasth. Health is number one. But if you can give just maybe 3 4 tips people can incorporate. One you have already mentioned about sleep and it's correcting the food habits, but a little more, uh, concrete. Maybe 3 4 things if people can do on a regular basis to avoid getting chronic conditions in the first place. नहीं तो
Hmm.
to avoid, of course, nadi pariksha. And if you can also just talk a little bit about what is नाड़ी परीक्षा क्या है, हाँ हिंदी में भी बोलेंगे. तो क्वेश्चन ये था डॉक्टर को कि आप अभी इतना सबके लिए बिजी चलती है लाइफ, तो 3 4 टिप्स वो बताएं कि हम अपनी लाइफस्टाइल में इनकॉर्पोरेट कर सकते हैं. और दूसरा थोड़ा नाड़ी परीक्षा क्या है, इसके क्या फायदे होते हैं, इसके बारे में थोड़ा बताएं. यस डॉक्टर शारिका जी.
Yeah, so to summarize whatever we discussed so far, this is very easy to plan. One is, as soon as you wake up, you observe how you feel in the mind and in the body. Okay, this is a few seconds you can give every day, isn't it? As soon as you wake up, you just don't jump out of the bed. You're awake, you're just keeping your eyes closed and just observe, okay, how am I feeling in my body? Am I feeling any aches and pains or heaviness or anything, lightness, whatever it is. Mm. So that observation. And then how do you feel in the digestion, the stomach? Maybe you are feeling bloating or gas. You're feeling light. You're feeling heavy. What is that you are feeling? And then mind also. What is that you are feeling in the mind? Am I feeling happy and light? Have I had a good sleep? You're feeling that contentment after good sleep. Or am I feeling anxious or fear? Or am I feeling angry with something? So, this observation, if you can do every day, that itself will make a huge shift in your daily routine. So, why you are feeling like that? It is because of something you ate, some lifestyle you followed, something you are not supposed to do, but then you did it, right? So that understanding and awareness will develop, and then it will help you to plan the day better. Okay, yesterday I ate this, then this. Oh, that's why I'm feeling like this in this morning. Maybe I should not take it so much. Instead of 2 portions, I should have taken only one. Are you getting this? So 2 portions of pani puri, 2 plates of pani puri gave you acidity. But then when I ate 4 pani puris, it didn't give me acidity. Are you getting this difference? Okay, so where to stop, how much to eat, all that you need to become little aware of that. Individually, we cannot do that, isn't it? That is your own work to do. So do this practice morning. As soon as you wake up, you observe, and then if you are able to relate to what caused it, then that will make so much of changes in your life. And so that is one practice. And then second thing I always share with everyone is keep your meals away from the sleep. That means as soon as you wake up, don't eat. And don't eat and go to sleep. So when will you eat? Breakfast? Give some time. Give some time. That doesn't mean that you take your breakfast at 12 in the noon. You know, don't, if you're waking up at 7 o'clock, don't eat immediately. Give some time, maybe 1 hour, allow the Agni to improve, and then you have your meal. Give 1 or 2 hours. You can finish your sadhana, exercises, and all that, and then you plan your first meal. And similarly, in the night, you finish your meal, you allow the food to digest, and then go to bed. So that doesn't mean you're eating at 10 p.m. and then going to bed at, uh, 12 p.m. or 12 a.m. Are you getting this? So you cannot make that adjustment. You finish your meal earlier, and then so that you get enough time before you go to bed. So this is second practice that you can do. So that the meal times is planned during the day itself. Don't, not too late in the night, not too early in the morning. And then third thing is, if there is any elimination issues or gas, bloating, anything like that, then it is best to watch what you are eating. Keep your meal a little light for that 1 or 2 days. It could be something as light as a porridge or kanji or khichdi, dalia, something like that, very light, soupy. Mm. Add your spices, coriander, turmeric, ginger, all that spices are okay. Not making like a masala, like a curry, but simple spices, which will also help you improve your digestion. So keep it light for 2, 3 days. And then once you feel that appetite and hunger is better, then you can come back to a normal diet. So you have to listen to your mind and body, and then eat accordingly, your plan your lifestyle accordingly. That itself will change in within 1 day. I tell you, you can see the difference. You have noticed that, no? Some days you wake up very fresh and happy and light. Everything goes very well that day. Why? Because something that you did the previous day helped you with that. But we don't have that awareness. So that has to come back. So these are three things. Watch what you feel in the morning when you wake up. Second thing is you keep your meal away from the sleep, right? And then uh, keep your meals light for few days. Whenever there is some energies, you're feeling low, lethargy, dullness, digestion is slow, elimination is not well. So then you go to a light diet for few days. So this will help a lot. So Nadi Pariksha, the relevance of Nadi Pariksha is at two situations. One is if you're not able to figure out what imbalances you are having and where to start, what to do next, what is priority. There may be so many imbalances, what to tackle first and then what to do next. So that clarity you will get it when you do a Nadi Pariksha. And then once you are balanced out, everything you are sorted, everything, then to keep maintaining the balance and you see, keep checking, okay, everything is okay or not. Then also we need Nadi Pariksha. So with that reference, we'll understand uh, where you are standing. Am I maintaining it well? Or is there anything that I have to put my attention to? So this is very, very helpful with Nadi Pariksha. Nadi Pariksha, we have a lot of Vaidyas all across India. So they touch the pulse. They touch the pulse and then understand all the imbalances that is happening in your system. And then accordingly, they plan the supplements or herbs or remedies, medications, or maybe sometimes treatments. That is very, very, very good practice to do. Every few months, you can do that. And according to their guidance, you can follow whatever they're guiding with the food or medications. You can follow that as well.
Very, very helpful, doctor. I think everyone has taken away lots and lots. One last question from me. And if we have time, maybe we can take one or two questions from live if people have. So my last question is that people today are not taking out so much time for their own sadhana. When life is going well, why should I do an advanced course? What is the need? I can do my kriya once in a while. It's okay. Do it once in 2, 3 days. Can you please explain a little that how can actually doing kriya, doing yoga, advanced courses, how can these practices help in improving our health?
See, if you actually observe, imbalances doesn't happen all of a sudden in the body. It will manifest in the energy level, in the mind level, and then it will start affecting the body. It will start reflecting in the body. So the best way to balance that is nothing other than meditation, pranayama. Mm. So that is really, really important. And even as a detox, when you see detox, Panchakarma will help in the detox with all the imbalances that is happening in the mind body level. But then to a certain extent, the mental or energy based imbalances, you cannot detox with medicines alone. That for that, the best detox is doing meditation. And not just a daily meditation, intensive meditation with knowledge. Gurudev say knowledge also will help cleanse the system. So all the three has to go hand in hand: knowledge, meditation, your sadhana, and then physical detoxes, fasting or with medicines or panchakarma, whatever form of detox. So everything has to go hand in hand, and every year we have to do that to maintain the system. And you can see the threshold, no? Once you do the detox, you can see, okay, I am symptom free for 1 month or 2 months or 1 year. Some people even 2 years, and then again slowly all those symptoms starts coming back again. So it is best to keep that periodically you do that. Even maybe we've discussed earlier also Navratris and all that. That is the time for detox. That is when there is a 10 days silence program, and there'll be a fasting routine. Diet is you watch your diet, you meditate, chanting. So everything together, it's like a deep cleanse that happens. Mm. So it is very important to do that. You may feel even recently there was another patient 2 days back. He is following a very good routine. He is following a very good, food habits is perfect, but still he has developed some kind of a toxin. So his liver has become sluggish. So he's surprised how it happens, but he's never done a detox. So that that is, we don't know how toxins accumulate in the system. There are so many factors that can result in the accumulating that toxins in so many ways it can happen. So periodically it is better to do that, but then it is not just about taking medicines and doing as a treatment. It is also it has to also supplement with mind and pranayama, your prana levels, knowledge also uplifts even if you are all that garbage of emotions and all that, it clears it out, right? So everything has to go together.
Dr. Sharika ji, yes. Like
Ma'am, knee
exactly
pain,
like हाँ so
knee pain removal का कोई idea?
Sorry.
Knee pain removal.
As a knee pain knee pain, we have to find out if there is arthritis tendency, wear and tear, osteoarthritis, if the fluid has already gone or any tissue damage there. So all that we need to see, and accordingly we have to treat. It's not one
Okay.
dose and it's gone. It is not like that.
Okay.
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 we
Ma'am, I
can,
have a question.
yeah, Vikramji, yeah.
Ma'am, I'm based out of Goa,
Mhm.
and I have a 3-year-old son who keeps getting cold, and as usual, what school children get virals and cough and all that. So, ma'am, since you're not based out of Bangalore, then how do we approach a local shishi doctor? Because I don't think so. There's a full-time station doctor in Goa.
I'm so right now we have several doctors traveling across India,
So
and
they
I'm,
come only once in a month.
oh, is it okay? I can find out. Maybe there is a coordinator in that area. We can find out who's.
So I know, ma'am, who comes. I go to him, but he comes only once in a month.
Huh. So what? So you can connect with any doctor online also. No? All of us consult online as well.
So, ma'am, without seeing the nadi, you can advise online.
See, Ayurveda, it is not, Nadi is only one way of diagnosing,
Okay,
one tool. So there are several ways of understanding the disease and prescribing.
okay, okay.
So
And
it,
ma'am, my wife is suffering from ulcerative colitis.
mm-hmm.
So, ma'am, the allopathy doctors are against any Ayurvedic medicines. They are okay if you make medicines at home. Like, say for example, you have dhania water every day. Example, I'm just hypothetical example I'm giving. So, saying anything that you have homemade, you have Ayurveda, we have no problem. But
Mm.
don't buy anything off the market because you don't know what quality ingredients are being used, and there is no kind of an FDA kind of strict, rigorous quality control standard.
Uh, so Ayush Ministry and there is definitely quality control standards in Ayurveda.
Okay,
Most of the medicines that come into the market, you cannot sell it without that approval. There will be clinical trials and all that norms are there even in Ayurveda. And then even so most of the medications, especially Ayurvedic formulations, classical formulations, they are they don't change the formulation. It is as it is told in the classical texts. So that's
okay,
one thing. And proprietary medicines, of course, they have very strict rules before putting it into the market. So
okay.
it is all this, I mean, some kind of discussions that goes around.
Yeah, ma'am. So allopathy doctors always bitch about Ayurveda, and so I don't fully agree with them. I only had apprehension and partly agreed because there is no probably the quality standards or the audit standards or the frequency of audits may not be as much as what pure play pharma company are. But since you mentioned that even Ayurveda has now been subject to scrutiny, then it's not scrutiny but regulation.
Yeah. Yeah.
Then
So then there are
then
many very good brands. They don't compromise on the ingredients and all that, for sure.
okay.
It's
So
not that all allopathic doctors are against Ayurveda. I have so many friends, allopathic
yes,
doctors,
yes, of course.
support very, very well Ayurveda also.
Ma'am, one last question.
There's,
Ma'am,
there's,
there is
I have
this
a question.
Zandu brand as a Nityam tablet, to clean the bowels.
Mm-hmm.
Uh, it is for basically cleaning the bowels basically. Even Shishi Tattva also probably has. So, ma'am,
Mm-hmm.
I've experienced that whenever I have that medicine, say I've overeaten or something, and I have the tablet, next day my weight shoots up. Is there a lot of water retention which takes place after having that?
I'm not sure about that. Nithyam, I don't use much, very
Huh.
rarely. So
So, ma'am,
I
which is the
have to
equivalent?
No, it is not like that. In Ayurveda, medicines won't work like that. We have to understand how your body responds, what are your imbalances, what are your tendencies. Based on that, we decide which drug to be given. So
Okay,
you
so
cannot take things like that over the counter. Yeah.
it's not like like a laxative, like a Dulcolex, which you can just take.
In Ayurveda, there are thousands of formulations which help in bowel movement. So what
Okay.
works when, where, all that we have to look into.
So, ma'am, I have done the doc with Dr. Digvijay Singh. He's done my Nadi Pariksha in Goa. I have his report with me, his diagnosis. So, ma'am, if I want to consult some other doctor, or should I consult with him only? But he's usually very busy.
Uh,
It's your
So,
decision.
so
yeah,
what I
ma'am, I
will
have
say
a
is,
question.
for the, for more questions, maybe you can just
Yeah.
connect with me. And if you need,
Okay.
number of our
Yes,
Shri
you
Shri Tattva
understand
Panchkarma
that.
Center for booking any consultation, then I request everyone, you please just connect with me and I'll share the number and you can, book
Can I
your
ask
Nadi
one
Pariksha
question, if you don't mind?
consultation.
I just wanted to ask one question.
Yes, Monali ji.
See, from past 5 minutes, I'm trying to ask. Actually, ma'am, you said that we need to be aware of our routine. I understand, but if office we have shift timings, we cannot do anything. My shift gets over at 12.
Hmm.
So, it has affected me in many ways.
It's time
But
for
there's
bed.
no, I don't know what to, how to get rid of this, or I don't know how to manage this because
Hmm.
there's no other option.
And so it is always going to be like that. It is a temporary shift.
No, at least for another year or something. Maybe.
Hmm. It's very tough to manage. I mean, you can manage some with some periodic minimal cleansing and all that, maybe some supportive medications. But the only issue here is with this habit, this kind of a routine. If you develop some chronic imbalances, it will take time to reverse it also. So periodically, you need to be cleansing your system, even though your routine is like that. You don't miss that. Mm.
Mhm. Cleansing means you mean panchakarma treatment?
When panchakarma, that you have to decide with the doctor, of course. I cannot tell you
Mm.
like this.
No, I have been regularly doing all checkups with Nadi doctors.
Other than that also, you
Mm.
practice some small cleansing once a month or something like that. With some,
Mhm.
you talk to your Ayurveda doctor, they'll be able to
Mhm.
guide you. So that your liver, your digestive system, all that is supported. Mm.
Mhm. Okay. Thank you. Jai Guru.
So what we'll do is that I know people would have more questions. So one is if anyone needs the number, just please message me, and I'll give the number of Shri Shri Ayurveda Center in Bangalore Ashram. Number two, we will try and organize one Shri Shri Swasthya camp where you'll get like a 2 hours across 4 days, a little more detail about Ayurveda, some more things on how you can put in your daily practice. So if anyone, whoever is interested, you can message, we can organize that also. And last thing is that, I would urge and encourage everyone, like, Dr. Sharika ji said, that do your daily things, like, do your kriya, do your pranayams. We also have a online meditation and breath workshop coming up towards the end of this month. Um, Damni, if you have a poster, if you can share, so it will be taught by Mahesh Sharma ji, who is a senior faculty, and we both are co-teaching it. So, if you haven't started your, Kriya in some time, you can just restart, refresh. If you have been doing it every day, then also it's great. But definitely do the Kriya and, pranayams, meditation, all of those.
Can I
And
ask one question? Is it possible? Do we have time for one question? Dr. Sharika Menon, is it
Yes,
possible?
sir.
Dr. Sharika, good evening. In the earlier part of the session, I heard you talking about the Vata imbalance, which I felt that a lot of people today, I can see the ailments you mentioned. A lot of people. So I wanted to know, people in the youngest age group. I mean, like me, people call me the youngest yogi in my group. So I think. Do you have any tips for people like me who in our age group to be able to get saved from, I don't know whether I'm using the right word or not to get this vata imbalance so much, because that causes a lot of devastation in lives.
Mm.
How do we people at our age, I mean, I'm not talking of medication.
Yeah.
What about the Ayurveda routine for for our age people to be able to lead a healthy life and not get afflicted by vata imbalance?
So usually, the vata tendency, as you age, vata tendencies are more. You are prone to vata tendencies.
Yes, that's what I asked. That's why I asked.
So Abhyanga is very good. Abhyanga is like oil bath. You apply
Yeah,
oil and
yeah, yes,
take bath. I remember my grandmother never missed Abhyanga a day. So
yeah.
every day, both my grandparents. So
Mhm.
and they were so healthy. Their
Healthy.
digestion, their bones, everything. So for I would request all this after 60s. It is best to do the Abhyanga. Of course, there are few don'ts. In certain conditions, Abhyanga will not work without your doctor's permission. Don't do it. But then, as a general practice, it is very good to do Abhyanga on a regular basis. So apply oil, sit for 5-10 minutes, take a warm shower, wipe it off. You know. So that is one.
That is
And
one.
good sleep, and sleep in the sense the number of hours, ideally by 10:30 you should go to sleep. So if you're spending too much time in with the screen late in the evenings, you know, before sleep you scroll through the phone and all that, that will also aggravate the vata. So that is another, that is not just for this age group, any age group.
Any age group.
And then nourishing food. The food has to be more nourishing. You don't cut down on this natural oils. Go for fat-free food and all that. No, some people think having some natural fats is also a problem. So that is not a good idea. So ghee in your diet and any oils that goes not deep fried, of course. Like if you put tadka or you add ghee in your roti or rice, all this is a good practice because that will also nourish and balance vata. So
Okay.
especially bones. It is told when you are having healthy fats, it will strengthen the bones also. So many a times, if you are going fat free, then for sure your bones it's going to be brittle. So these things will definitely help with that um, vata changes, and some rasayanas. So some rasayanas like Brahmarasayana, Chyawanprasha, all these are like rejuvenating medications. So
Right.
that is also good to have regularly. So that one can talk to a doctor and decide which rasayana works for you, and then they can adopt that also as a daily, uh, like a medication supplement.
Right. Thank you, doctor. Thank you so much. Everybody here, all of you who are watching, I must confess, I idolize Dr. Sharika Menon, and I was very fortunate to actually accidentally meet her in a session with the SSU um, uh, while doing a course, and she mesmerized all of us by how incorporating Ayurveda with career counseling, and that was the first meeting. And after that, a visit to the ashram is incomplete till the time I have my nadi done. And I think I'll have to fall ill a little bit just so that I can go and meet Dr. Charika. And of
You
course, once or twice a year online also. So I think some of you were concerned about how to meet online people. Uh, Priyanka will give you that number, and you can always ask for a particular doctor also. And I would say you can ask for Dr. Charika Menon. She's right there for you all the time. And when I tell others, I say, अगर रामबाण दवाई चाहिए तो डॉक्टर शारिका पे चले जाना. So I am very, very fortunate. Thank you so much, doctor. Thank you so much.
Sir, One correction I want to make, you don't have to be sick to meet me. You can
That was that was
that will be more,
a
I'll be
little
more
exaggerated.
happy then.
Of course, ma'am. Thank you so much.
So I take this opportunity because we are, well past 9. So I take this opportunity to, once again thank Dr. Sharika ji. I must tell everyone that she is really busy. I mean, she does from morning to evening. She's doing her consultation, treating people, and then she's teaching people. So, very, very grateful, Sharika ji, on behalf of the entire, this was actually brought, the Shishi Yoga monthly classes. We've been having those for the last 3.5 years. Mahesh Sharma ji, Mahesh Bhaiya, as we, say, is a senior faculty. And we have been teaching it for last 3.5 years that monthly classes are going on. So as part of that, so very grateful, Sharika ji, for you having taken out time for all of us. Um, and
प्रियंका
yeah,
जी,
हाँ,
मैं ये पूछ रही थी, वो हार्मोन्स चेंज के लिए कुछ बताएंगी? जैसे इस एज में जो होता है मेनोपॉज हार्मोन्स चेंज का, उसके लिए कहाँ दिखाएं?
कार्ड दिखाएं तो आप मेरे से नंबर ले लीजिएगा और मेरे से नंबर लेके आप कंसल्ट कर लीजिएगा डायरेक्टली, ठीक है?
अच्छा, इन्हीं का ही?
आप मेरे से नंबर ले लीजिएगा
ठीक
एंड कंसल्ट कर लीजिएगा.
ठीक.
So thank you so much, Dr. Sharika ji. Very, very grateful and pleasure. Thank you.
Thank you so much. Jai.
Jai Gurudev. And for everyone, just want to again remind you, we have a online meditation breath workshop end of the month. So if you want to just refresh, you're more than welcome to come and attend, and bring more people to the path. And it will, what you give, you get. So health party, give good health, peace of mind to everyone. That is what we all get back. Great, great, great. So thank you, everyone. Great, Dheeraj. So we'll just end the meeting now. Jai Gurudev.